In this video, you will learn how to schedule visits in the Axxess Home Health solution. First, let's review the company setup. Under Admin, Company Setup, add your signature and select Proceed. To the left, under Scheduling, you can customize multiple scheduling options. Under Orders-Driven Scheduling, you can enable or disable the frequency and duration warning. Enabling this feature will alert users when a visit is scheduled outside of the frequency and duration orders. A warning symbol will appear to alert the scheduler, but will still allow for scheduling. The next choice is to enable or disable frequency and duration compliance. When this feature is enabled, the scheduler will only be allowed to schedule within 7 days of the OASIS or orders until they are completed. When enabled, you may choose from allowing the scheduler to schedule any type of visit or for assessments and evals only. Under authorizations, when enabled, this will prevent clinicians from accessing visits without authorization warnings. This helps to improve scheduling and minimize staffing costs by eliminating unauthorized managed care visits from being charted. Delete visits after discharge. When enabled, this will automatically delete remaining visits when a discharge visit has been completed and approved by QA or the patient has been manually discharged from the agency. Auto-generate recert episodes. Enabling this feature will automatically generate a recert episode when a patient with a scheduled recert reaches the last 5 days of their current episode. You will be able to add an episode manually as well. Once you have verified your company setup, select Submit Request. Now, let's review the user's rights and permissions. Under Schedule Management on a user's permissions, you have 2 options. The first option, Schedule Visit Activities, will allow a user to schedule for any patient. Edit Episode Information will allow a user to manage the patient's episode and change dates of episodes, primary payer, primary physician, and even be able to add episode alerts or inactivate an episode. When you're done, hit Save or Close. Okay. At the top, you have a Scheduling tab. If you come down to Schedule Center, you can choose between multiple locations, active discharge pending patients or non-admitted patients, different payer types, or search by a patient's name or medical record number. Select the patient you would like to schedule. At the top, you can see the patient's name, and you can choose from a drop-down for which episode you'd like to look at. To the right, under Actions, you have a Refresh button and Manage Episode. If you have privileges to manage an episode, you can switch between one admission or another, change the episode start date or end date, change a case manager, primary insurance or secondary insurance, primary physician, whether or not authorization is required, and inactivate an episode. You can also add an episode comment here. This comment will appear on every task and be able to see an activity log of what else happened with this patient. At the top, you will see a calendar. It will appear for the first day of the episode through the last day of the episode. You have a key for anything in blue is scheduled, green is completed, red is missed, purple shows multiple different tasks on a certain day, or if it's been disabled. If you hover over any day that has a color on it, it'll show you what all is included on that day. You can switch back to the patient's chart here. If your frequency and duration warnings are enabled, You'll have this first column here. If you hover above the F, it says frequency and duration summary. Tell you how many summaries or warnings are included for that patient. You can see if I have a check mark here, it is in accordance with the orders, or if it does not count towards your frequency and duration. There will be a warning there if you're scheduled outside of your frequency. This next column is for authorization. You have a task column. Anywhere that there's a hyperlink, you can see this one. This blue start of care is hyperlinked. I can click on it and start my documentation. The next column is for a schedule date. Who it's assigned to. If you're in a state that has Axxess Care, this next column would have a heart for Axxess Care if it's assigned through Axxess Care. Your status of that particular task. The next column, if it is a visit that has EVV requirements, you'll have a little house here. The next column will be on for OASIS. Once completed, you'll be able to see some OASIS information. You'll have alerts that you can hover above for the next 3 columns. A printer icon to see what the note would look like when printed. A column for any attachments added. And an action column here to make changes. You'll have details or to be able to delete if you have permissions. Selecting the header of any columns will put them in ascending or descending order. To the right, you have Show Schedulers. If you select Show Schedulers, you'll notice that it'll be broken down into different tabs. It will default for a nursing tab. To schedule one visit at a time from here, you can select the calendar. It will add a date. You can choose the type. You can choose by typing. If you want to start typing, it'll automatically populate. Same for the user. And you can select Save. If there is any licenses that will be expiring within the next 30 days, or any policies, anything that needs to be updated on that user's chart, you will get a warning, but you will still be allowed to schedule. You can schedule up to 5 visits here, but just note you'd have to go through and select each one separate. You can flip to another task. If you are on a different task, you will only see the type of visits for that tab. You also have a daily outlier tab here. You can choose the type of visit you would like, the clinician, the start date, and end date. So this will schedule from 9/27 to 10/3. I'll hit save. And if I select the HHA tab here, it'll only show that task. You can see that it's scheduled daily visits for that time period. You can also see down here, I have the warning saying that it exceeds my frequency and duration. I do not have an order for that many visits. Across the top, you have several tabs. If you wanted to create a new episode, you could select New Episode. You'll have your admission date here. It'll tell you the last episode end date. You have an episode start date, an episode end date. It will automatically go to the next day after the last episode end date for you. But you can adjust it, make any changes that you need to here, as well as add an episode comment if you'd like. These comments are unique to the episode, but will go to every single task on that episode. Under Episode Manager, you have a visit log. From here, you can choose to make a visit billable or payable, or uncheck them. You can also go through and mark them completed. If they're a visit or task being done outside of Axxess, you can mark them completed, add a time in and time out, travel time if you wish. Not mark that visit as completed. You can view inactive episodes. You can see any frequency and duration summaries. This will tell you if there's anything that doesn't match your orders. So you can see from the key just below the mouse that the blue means the frequency from orders has been met. The green means the scheduled visit count matches. Red means the frequency is over, the order is over or under, and the visits are order or over, under or over. Again, you have different tabs here at the top. So you're only seeing one discipline at a time, or you can choose to see all. In a list format down here, you can see week 1. It'll show me my frequency start date and end date, what my discipline is, how many visits I have for my orders, and how many are scheduled. So if I hit the plus sign here, I can see from 9/14 to 9/19 under nursing, I only have an order for 1 visit, yet I have 2 visits scheduled. If I needed to go through here and delete a visit, I can do that straight from here and see that now they are in blue and green and match. It will show me all disciplines here. And anytime that there's a warning, I can see what the issue is. Scrolling back to the top, you can switch between different disciplines. And you can see I have too many visits scheduled here versus what I have ordered. And you can switch to all disciplines. At the top, you can refresh this. You can also select Schedule Employee. On this page, I can see my frequencies at a quick glance. I can see for skilled nursing, it's once a week for 9 weeks. And I know that I only have 1 visit up here for skilled nursing scheduled. I can choose my clinician, or I can post my visit to Axxess Care. You can choose a visit type, and then simply go through and select the visit dates that I would like to schedule. If I want to leave this last week open instead of scheduling a skilled nursing visit, I want to schedule research, I can hit save and add another. We'll then go through, add the clinician again, search for my Oasis D1 research, and select the day I'd like to schedule that, and save and exit. I can see all of my visits now match. They're all blue and green, they all match. I can then go back to Schedule Employee and do the same for the other disciplines. If I want to view my frequency and where the frequency count is coming from, I can hit View Episode Frequency. I can see there's a physician or for skilled nursing 1 week 9, a physical therapy once a week for 1 week, and a home health aid order for 3 times a week for 8 weeks, and then 2 times a week for 1 week, effective 9/14/2020. Under Episode Manager, the next tab is Episode Frequencies. If I select this tab, I'll see the visit type, frequency, and the visit count. Under Schedule Manager, I have a master calendar. From here, if I hover above any day, I can see who's been scheduled and what the visit status is. I can also select to show missed visits or not, and be able to hit print. This will create a PDF with the information already enlarged. I can skip ahead to the next episode or go back to the previous episode. Under Schedule Manager, I have Schedule Employee. This looks just like it did on the frequency and duration, follows the same rules. You'll be able to select the clinician and the visit type and be able to schedule whatever is needed. My task was scheduled for user successfully, and I can close. I can also reassign schedules from here. Now note that this is for the patient only. So if you are scheduling, if a nurse is out on vacation and you needed to schedule multiple visits of theirs to other users, this is only for this one patient. So I could move all of the visits from me to another user for a particular date and time. It's automatically going to default from the episode date range. It's only going to change anything that is not or not yet due. I can reassign those. You can see down here, there's one that was already marked completed. It did not change. As well as the start of care that isn't saved. Under Schedule Manager, if you have permission to delete tasks, you'll have delete multiple tasks here. Here you have the option to check or uncheck. Again, you can also go through and click on the title and put them in ascending or descending order. So if I wanted to get rid of all the home health aide visits, I could come through here and check them off. And select delete. Are you sure you want to delete these events? And you select OK. If you want to double check that one tab, you can see all of those events have been deleted. Now, if you have the rights or permissions to delete something on a patient's chart, you'll also underneath View Patient Chart. In the quick reports for the patient, the very last item here is deleted task and documents. You'll be able to restore anything that you've already deleted. Okay, back on the Schedule Center. That was the last item under Schedule Manager. You'll have an item for authorizations and pre-claim review if that applies for your state. You'll be able to post visits through Axxess Care if that applies to your state, and you'll also have a 30-day calendar. Under your 30-day calendar, once the OASIS is completed, you'll be able to see any LUPA risk, LUPA threshold. You'll be able to see different episodes if you'd like to tab back and forth. You'll be able to see what is scheduled the first 30 days and second 30 days. You can click View Frequency and Duration to be able to see any orders that have been put in for that patient. You have a key here that tells you the status of that visit. You can hover over any visit to get a phone number for that clinician. A blue circle will indicate the date. You'll be able to see the end of the 30-day period. Care period decision is due. And if you toggle over to the second 30 days, you'll be able to see the end of episode. Under schedule, you have a few other items here. My schedule and task gives a to-do list basically for your clinician that is logged in, showing any pending task. Schedule unassigned visits. From here, any visits that have been scheduled maybe over or under what is frequency is ordered, it doesn't match, will show up on this list. So ideally, you'd want to be able to clear out this list every single day. You can search by location. You can filter by different payers or search by a patient's name or medical record number. This is the one we were just looking at. You can see that across the board, I have blue and green for all of my nursing ones. Always before clearing out the name, you want to be able to search all disciplines. I can see that I've got a mess with my home health aide and my physical therapy. So let's go through and schedule those. If I click on this tab, this looks just like what we did on the Schedule Center. For physical therapy, if I want to go through and schedule it out, I can see I need to schedule from 9/14 to 9/19. I can schedule my employee. And I'm going to choose the physical therapy assessment and evaluation. And we'll say they're going to go on the 15th. And I'll save and close. That made those blue and green until that physical therapy assessment and evaluation comes back with further frequency orders. And then I can see down here, I still have problems with my home health aide. I can look and see across the board, I've got 3 times a week that needs to get scheduled out. Until that last week that I only have 2. I can choose schedule employee, select my user, select my visit type, and then select the dates that need to be scheduled. And the last week only had 2. Save and close. Now it is blue and green across the board. If I look at my list, I can see it's green check marks all the way down. I can choose all disciplines, and I can see it's blue and green across. And I'm going to select Visit Assignment Complete. When I choose Visit Assignment Complete, a pop-up will appear. Are all visits for the patient assigned? Select Yes to confirm that scheduling is complete. This patient will be removed from the unassigned visits list. So I'm going to select Yes, and it came off of the list. So ideally, you'd like to be able to clean out the list every day and be able to solve any frequency issues you may have. Under the Schedule tab, we saw Schedule Center already. You have Reassign Schedule. This will move multiple patients. So earlier we saw it in the patient's chart for just that one patient. From here, if I wanted to go through and schedule everything from me now to another clinician, from a certain date to another date, okay, so I'm going to go from 9/15 to 9/19. Then any tasks that are not started or not yet due are going to get reassigned to another clinician. I'll select Reassign, and those tasks have been reassigned successfully. Under Schedule, you have an unscheduled visit report. Under Schedule, you have Unscheduled Visit Report. This will provide a report to you for any visits that have not been scheduled yet, but you have an order for. The next report is a schedule report. Here you can choose different branches, patients, search for a particular clinician, And I'm going to choose that clinician that I scheduled all of my visits to. You can choose a date range. You can select a status or multiple statuses. This box here, you'll need to choose a one or the other. If I choose a task, it would be a particular task, or I can choose a discipline and check multiple disciplines off or check all. Then I can hit Generate Report. From here, I can see all those visits that we just reassigned. Okay. Again, you can only reassign things that are in not yet started or not yet due. So if you look down here, these 2 visits, they're in saved or submitted. I do not have a box to select. I can multi-select, or I can select all. And then you can still uncheck certain patients if you'd like, or visits. From here, you can reassign selected. Or you can go through and select one at a time to reassign. You can see that these have been reassigned now. Back to me. You can also export this list to Excel. Next, under the Schedule tab, is a Schedule Deviation Report. Under the Schedule Deviation Report, this will show you any tasks that you scheduled on one day, yet inside the visit note was selected a different date. You can choose between different locations or different date ranges. So generate the report if you make a change there, and you can export it to Excel. The first column is a medical record number, the task, the patient, the status, the employee, the scheduled date, and the visit date. To remove something from this list, the schedule date and the visit date must match. So if you take one visit here, let's look at the second one because it's in save status. This one up here on the top is completed. So let's look at this next one here. This clinician had a visit scheduled on September 9th, but when they documented in their note, they moved it to September 8th. So if I want to go search this, let's look at this particular patient. You go to their patient chart. And it's the first patient here. And let's go to their schedule. And let's go back to that episode. It was 9/8 and 9/9. I can see this skilled nursing visit on 9/9. They have it saved under 9/8. If I go to menu and details, I can see it was scheduled originally for 9/9 and she moved it to 9/8. If I am okay with her visit being on 9/8 and her moving that visit, I can move my schedule date to 9/8 and select save. If I click generate report again, that visit came off of the list. So the only thing you have to do to make them come off of the list is to make the 2 match. This concludes all the scheduling tab tasks. There's additional videos for Axxess Care if that applies in your state.